Hi, I'm Dr Andrew Stevenson, Colorectal Surgeon at St Vincent's Private Hospital Northside and Associate Professor of Colorectal Surgery at University of Queensland. And today I'm going to be talking to you about colorectal cancer, how common it is, how easy it is to treat, particularly if it's caught early, what are the common symptoms, and how we've come a long way in the treatment of this common disease. Bowel cancer is basically an abnormality that arises from the lining of the bowel, which can then sometimes spread to other parts of the body, most commonly the lungs and liver. One way we can pick up if there is bowel cancer is to see if there is any small amounts of blood within the bowel motion. This is a test that's sent out by the federal government, the fecal occult blood test, which is like a birthday present for you when you turn 50. And then sent out every few years thereafter. That's to see if there is small amounts of blood within the bowel motions that you might not detect by looking at the bowel motion or on the paper. One of the good things about bowel cancer, apart from being very common, is that it's often very treatable if it's picked up at an early stage. Bowel cancers arise from polyps or abnormal growths arising from the lining of the bowel. These polyps can cause a small amount of bleeding or other symptoms. And if it's picked up early, those polyps can be taken off at the time of colonoscopy. And the colonoscopy is the way that we can examine all of the entire part of the large bowel to look for these polyps, and if they're not too big, we can usually remove them before those polyps become bowel cancers. We have made a number of advances in both the diagnosis, the staging and the treatment of bowel cancer, particularly over the last 30 years. And indeed, this institution and the surgeons here have been at the forefront, both nationally and internationally, in research into developing new techniques for the treatment of bowel cancer. These new techniques involve minimally invasive surgery, keyhole surgery using either laparoscopy or robotics.